But like I said, this is not just another CEU, okay? This is going to change how you do feeding therapy. And honestly, even if you only joined for the TOTS and Myo modules, because a couple of people have done that and they're like, oh my gosh, that was worth its weight in gold. It will pay for itself in your clinical confidence and in the referrals that you start to attract and in the results that you're getting your patients. And so, like I said, we've had grads enroll just for these modules, and they tell me all the time, they're like, it was worth it. That alone was worth the investment. Hello, my friends, and welcome to episode 338 of the Untethered podcast. This is your host, Hallie Bulkin, and we're going to dive into an episode today that is a little bit different than what we usually do here. And before we even jump in, I do want to apologize because I have my Murphy in my mouth now. And if you've listened recently, you know I was getting it. But if my speech sounds a little bit different, that is why. I'm going to do my best to speak super clear. But here we are. Welcome to the Untethered podcast. I am your host, Hallie Bulkin. I'm a certified myofunctional therapist, feeding specialist, podcaster, business owner, and mentor. This podcast is all about getting your questions answered and collaborating with colleagues to bring you the most up-to-date information in the orofacial myofunctional therapy, airway, tethered oral tissue, and pediatric feeding therapy space. If you're new here, I challenge you to keep an open mind and join my mission to spread this message far and wide. If you've been around since June 2019, thanks for being a loyal listener. As we jump into today's episode, remember to listen with correct oral rest posture. Tongue up, lips closed, teeth apart, breathe through your nose. Let's get started. Okay, so as I mentioned, today is a little bit different, all right? This is a bonus episode because we are officially in the final days of enrollment for my course, Feed the Peds. And I don't want you to miss this opportunity if you're an SLP, an OT, a PT, and interested in or currently working in the pediatric feeding space, okay? So if you are listening to this on the day that it drops, you have just 24, maybe 48 hours before doors close. And they are not going to open again until next year, until 2026. This is the last time we're offering this in 2025. So in this short little episode that we are recording here, I'm going to share a sneak peek into the real gap that graduate school left, all of us really, when it comes to pediatric feeding. And there's going to be a little clinical pearl that I'll share that you can use right away. So if this resonates, I do want you to go over to feedthepeds.com so that you can enroll before doors close. But let's jump in, okay? So let's first start with talking about the gap that they just don't teach. Because here's the thing, okay? Grad school did not prepare really any of us for pediatric feeding. I think there's maybe, I can count on less than two hands the number of graduate programs that teach pediatric feeding and swallowing. A lot of programs are focused more on dysphagia, in adults and not so much in pediatrics, which is unfortunate. And we're really hoping that changes. But in the current reality, this is what we're dealing with, right? So it didn't teach you then, right, how to assess a toddler who's refusing solids. It didn't show you how to screen for tethered oral tissues. It didn't give you tools to adapt myofunctional strategies either for the birth to 5 population. Those kiddos who are not appropriate yet for a traditional myofunctional therapy program. Because even if you are lucky enough to go to one of those programs that does teach pediatric feeding, again, there's maybe, I think 6 of them total that I'm aware of. Hopefully there's more out there that I don't yet know about. But if you were lucky enough to go to them, they are not talking about tethered oral tissues and adapting myo strategies for the birth to 5 crowd. But these are the kids that are showing up on your caseload, right? So what happens? You're left Googling, piecing things together from Facebook groups. Maybe you're watching random YouTube videos, but you feel like you're missing something big because the reality is that nobody who's ethically providing information out there is showing you how to do therapy with exercises and all of that on social media or on YouTube, because that's unethical and every child's therapy looks different, right? So we can't just go plaster exercises out there for you to follow. We can educate, right? But education can only go so far. So what happens, right? Again, you're left trying to piecemeal it all together yourself without the appropriate mentorship and guidance and, frameworks and information that allows you to actually step into critically thinking about these topics. And so that, my friends, is why so many therapists tell me, I know I need more. I just don't know where to get it. Like I knew I needed more, right? I just didn't know where to get it until I found Feed the Peds. And that's actually really exciting to hear from therapists because what I've done in Feed the Peds is unlike any other course out there. There's still 0 other courses that do what we do inside Feed the Peds. But what I will say is some people have said that just the TOTS and Myo modules alone are worth their weight in gold, and they would enroll in Feed the Peds all over again just to have access to that information. And that, my friends, is why I wanted to kind of focus on that for a few minutes today in this short little episode. All right. So let me give you a little taste, if you will, of what we cover inside the program. One of the biggest red flags, and I really don't love that term red flags, but I feel like everyone knows what that means. So we're going to roll with it. One of the biggest red flags for a possible tethered oral tissue, right, in toddlers, for example, is messy eating that just doesn't seem to improve. Okay. We get parents who say to us a lot, and maybe you have too if you already work in ped feeding, they'll go, their food just falls out of their mouth, or it's just always like, off the plate, on the side. And listen, I know adults like this too. But here's the thing. If you look closer, the tongue might not be lateralizing properly, right? It might not be moving side to side. That's what I mean when I say lateralizing. Maybe the food is pooling in the cheeks, right? They've got those cute little chipmunk cheeks, and it's not always because they still have the baby fat there. It's because those chipmunks are storing food in the cheeks, right? They've got those little chipmunk cheeks holding food, and it's not because they want to. It's because they're struggling to clear it properly. And instead of chewing efficiently, a lot of times these kiddos are mashing up the food, right? So if you're watching on YouTube, I'm just going to show you let me get one of my little mouth puppets here and show you what I mean by this. Okay. So they're doing more of this like up and down munch, right? The tongue might not even be moving. The tongue, like you see in this example, might be living on the floor of the mouth, and they're just going up and down, up and down, up and down, mash, mash, mash. So when I say mash, right, they may not even be moving the food to their molars, to their teeth. The food may just be existing wherever they put it in their mouth, or it might be moving to their tongue and staying there. And they're literally mashing their tongue up against the roof of their mouth. I had a kiddo once who I don't remember if it was like ramen or whatever it was. It was something where the veggies they were eating and the food they were eating was very easy to mash. And so people are like, oh, wow, that's that seems like advanced. This kid likes Indian food. This kid likes Asian food. This kid likes this other type of food. And we started to look at what the kid was actually ordering and eating. And yes, they liked the flavor profile, but the child was hyposensitive. They were not feeling things really easily. So that higher flavor profile was helping to kind of alert their mouth to the food, right, that was going into their mouth. And they were choosing foods that were either like steamed and easier to mash, or they were cooked in a way where it did not require a lot of, and so they could either munch, munch, munch and break it down easily, or mash, mash, mash and break it down easily. And so this is the thing that is happening, right? Like I said, instead of chewing efficiently, they are mashing that food up and kind of hoping for the best, right? So this is what a lot of therapists miss. Most therapists, in fact, miss this. And so inside Feed the Peds, this is one of the things that we talk about. We talk about chew patterns. We talk about, we teach you how to spot things like this, how to assess it, how to actually give parents and caregivers like a real explanation as to what is going on. And here's the kicker, right? When you catch something like this and you put the right plan in place, therapy actually moves so much faster. And your families start to feel relief, which in turn helps you to feel like, okay, I got this. Like, I know what I'm talking about. And you feel more competent as a clinician, and competence leads to confidence. And I feel like since I launched this course in March of 2020 and this podcast back in summer of 2019, I have talked a ton. Probably, you guys are probably sick of hearing me say it. If you've followed me for the past 6 years, you're probably tired of me hearing me say competence builds confidence. Competence leads to confidence, but it's true, right? And listen, at the end of the day, we do, I don't know everything. You're never going to know everything. We are all lifelong learners, right? But to even get a glimpse of confidence as a therapist, we have got to understand what we're doing and have the ability to explain it to somebody else, because then we get their buy-in. They help support the therapy. Therapy moves faster. Families, everyone's nervous system is in check. Everyone can take a deep breath. Listen, there goes my list for my appliance. Everyone can take a deep breath, and we all feel good, right? We feel like we're moving in the right direction. Okay. And this is, my friends, this is just one tiny little sliver of what we cover inside the TOTS and Myo modules. I just wanted to kind of give you a little sneak peek, a little clinical pearl, right? Because I want you to start looking at those messy eaters a little bit differently. Like, why is it such a mess? Why is the food falling out of their mouth? Why are they getting more on the plate, on the floor, on the table than they're getting in their mouth? And I'm not talking about babies who are learning how to feed for the first time. I'm talking about toddlers who have been on solids for a couple of years. Okay. So I want to just kind of frame that for you, right? Now, here's the other thing. I know some of you are thinking like, well, Hallie, this sounds amazing. I need this, but I've already spent a lot of money on CEUs this year. I just can't add another big course right now. And listen, I get it. I do, but I want to reframe this for you, okay? Because this is not just another CEU. And I think that's the misconception out there. People are like, oh, you're a CEU provider for ASHA and AOTA. Yes, we are. Oh, I don't need any more CEUs in the CEU cycle. Here's the thing. This is a comprehensive course on assessing and treating with a whole lot of other bonus information that is included inside this course, right? Aside from the actual bonuses, like there's just a lot more. Plus you get lifetime access to it, but that's a whole nother story. The other thing I want to mention too is that we do have a certification that follows. You don't have to get it, but there is a comprehensive certification as well. As far as this course goes, I mentioned you get lifetime access, there is mentorship, and it's ultimately a roadmap that you're not going to find anywhere else. It still does not exist even 5 years later. And I think we've done this course now 17 times, I believe. I think this is the 18th time we're teaching it and the last time in 2025. And so you're not going to find it anywhere else. Okay. And the reason why I feel so passionate about this and why I say this with conviction in the way that I do is because it's a 12-week course. And when you all enter, we break it down in a way that you're following what we call our elevation movement. And that's my methodology, right? This is a method where we combine skill set, which anybody can teach you, but we're including skill sets that not everybody teaches, and we're combining them and bringing them together, especially when it comes to TOTS and Myo in these little ones. Then we're also bringing in the mentorship component. A lot of people sell it and most people don't give it, or they don't know how to actually give it. And the really cool part about the way that we have structured our mentorship, and we've got 2,300, maybe it's 2,600. I have to go check the numbers, guys. I don't remember, but at least 2,300 graduates, SLPs and OTs who have graduated from Feed the Peds course. So we know this works because we have some really good case studies here. We're creating critical thinkers, and you all are turning into critical thinkers. I don't want to say we're creating it, but the way that we've created the program allows you all to go from where you are today to where you desire to be 12 weeks from now. And so we're seeing a lot of you come out asking different questions, treating patients differently, looking at it through a different lens, understanding where to go next in therapy. And yes, again, we all need to start somewhere, and we all need to have mentorship, like ongoing mentorship in any specialty that we seek out in life in any industry. However, the ability to assess and understand what you're assessing, make sense of it, right? Create a treatment plan, start therapy, continue therapy, and check in with mentors as needed. We don't see that coming out of most other courses. There are other courses out there that are like, okay, step 1, step 2, step 3. That is not how feeding therapy works, my friends. Like, you got to know that every single child who comes to you through a feeding therapy lens is not going to present the same, right? But there are certain foundational things like in skills that we can look at. And then there's other things that are going to change from kid to kid. Okay. So there's that. The third pillar of our elevation movement is identity. And I don't want to spoil it, but this is like a very brief thing that I walk y'all through in the beginning of the course before you even dive into, before we even release the first module. But so many of you are out there like, well, I can't call myself a pediatric feeding therapist. Why not? Are you, and we will never tell you to misrepresent yourself or your skill set, but so many people think that someone else needs to hand them a magical golden crown that reads pediatric feeding therapist to put on your head at some point in your career before you can call yourself that. We're not saying go out and say you're the specialist and the best person and everyone should just come to you. Like, that's a little arrogant and ego driven, right? No one's telling you that. But if you don't step into actually believing that you're a pediatric feeding therapist before you start to take these courses, you don't step into that identity, you're never actually going to step into becoming one. And this is why we have thousands now of SLPs and OTs who have come to us and said, this is the first course where I truly stepped into that identity. I feel like I know I'm a pediatric feeding therapist. I am here to help the pediatric feeding cases coming my way. And I feel ready and equipped, and they're actually going out doing it. And some of them have been, taking courses for years, and they've never actually gone out and treated a pediatric feeding case before. That to me is mind blowing, right? So when I say we're doing things differently, I mean we're doing things differently. There's a reason why this is the 18th time we're teaching it. We run 3 cohorts per year. This is the last one for 2025. But like I said, this is not just another CEU, okay? This is going to change how you do feeding therapy. And honestly, even if you only joined for the TOTS and Myo modules, because a couple people have done that and they're like, oh my gosh, that was worth its weight in gold. It will pay for itself in your clinical confidence and in the referrals that you start to attract and in the results that you're getting your patients. And so, like I said, we've had grads enroll just for these modules, and they tell me all the time, they're like, it was worth it. That alone was worth the investment. Okay. Obviously, you get way more than that. So go to feedthepeds.com, check it out. You'll see all the different modules that we offer you. I would love to have you guys join us. So here's the deal, okay? If you're listening to this on the day that it's airing, you've really got only a couple days left before doors close, because once they close, that is it, my friends. They close. They won't open again until 2026, as I've already said. And so that means this could be another 6 to 12 plus months of feeling like unprepared, turning away cases. Well, truly, yeah. We'll say 6 to 12 months, because we don't even have our launch schedule completely solidified for 2026 yet. We are working on that right now, so we will soon. But it will be sometime in the first quarter of the year that we run the next course, but I don't know when. So if, another 12 months of feeling unprepared, like I was saying, turning away cases, second guessing yourself in sessions, or you can make the leap now and finally have the training that you need. Okay. So if you go to feedthepeds.com, you can join us today before doors close. Please don't wait another year. If this is something you've been wanting to do, you owe it to yourself, my friends, and you owe it to the kids who need your help. I am stepping back into remembering why I did this in the first place. And like I shared with you at the beginning, I want to get kids off a pediatric feeding waitlist, and we cannot do that without your help. So if this is something you're feeling called to do, if you have questions, DM me at Hallie Bulkin on Instagram. I am here for you. I would love to answer any questions you have about the course. We also have something really cool, an AI component that is basically your pocket mentor. And you're going to get, when you enroll in Feed the Peds, you also get access to a 6-week trial with that. We release it at a certain point in the course. So that's really cool. And everybody is eating it up. Like, it has become such a cool tool that's only available through our programs. Anyways, Hallie AI, ask me about that too in the DMs if you want to know more. But I would love to just say, don't wait, join us. Can't wait to see you in there. Thank you for tuning into this bonus episode. I wanted to drop this in because I just think timing is urgent. I don't want you to miss out. And just remember, grad school didn't prepare you or me for pediatric feeding, right? But you don't have to keep struggling through it on your own. This is your chance. So I really do hope to see you inside Feed the Peds, and we'll see you in there. Quick disclaimer, all information, content, and material of this podcast are the opinions of the speakers and is for the informational purpose only and not intended to serve as a substitute for the consultation, diagnosis, and/or medical treatment of a qualified healthcare provider. Thanks for listening to this podcast. If you found value in this episode and want to hear more of these Myo, TOTS, airway, and feeding related episodes, be sure to leave a review on Apple Podcasts and share this episode on your social media platforms. You can access free resources and all I offer at HallieBulkin.com or pop over to @HallieBulkin on Instagram to get all the latest updates.